Ohio has really been ground zero for the opioid epidemic in the country. The consortium is important because it's the first of its type in the country that effectively addresses opioid addiction as well as treatment. It's a multi-pronged program that involves hospital providers and the community to work with each other to address the crisis. We have some of the brightest and most knowledgeable experts throughout our health systems in Northeast Ohio to work on this issue. By leveraging their skills, their practices, and the ability to willingly share that information across multiple systems, we're able to take that and really make a difference with the opioid situation. Our 5 strategies include healthcare education, improved prescribing and pain management alternatives, data collection, treatment options, and public policy initiatives.
The education program that has been put together by the consortium is helping in many different ways. One is it's bringing great thought leaders from all the members together to develop a program that we can use internally at each of our different facilities. It also provides a platform so that the patients hear and see the same message no matter where they are in the city. Good education really addresses multi-factors for patients and the healthcare workers. Multiple factors include the stigma, how to recognize opioid use disorder, how to recognize withdrawal, and how to really best manage patients through these situations. I think University Hospitals has brought to the consortium a true understanding of how to impact and educate providers on how to prescribe safely. I believe we've also brought to the table an approach that is unique and innovative, how to look at patients in a much more holistic manner through the work that we are doing at our Pain Management Institute. Some people have suggested that we just get rid of opioids altogether. We cannot do that. Opioids remain a very crucial aspect to how we provide care to many of our patients. We need to think about responsible, safe utilization of other potential modalities besides opioids, but when opioids are the right choice, they need to be the right and the safest choice. The consortium has done a lot of great work to help people understand and identify opioid use disorder and addiction.
We know in opioid use disorder, overdose death and deaths from heart infections and trauma and violence are tremendous threats that impact us every day. One of the most important efforts of the consortium is to improve the accessibility to addiction treatment regardless of what door the patient who needs that treatment walks through. The coordination with the consortium has allowed us to create systems to ensure that people who need referral for treatment get the proper treatment or in the best possible hospital for their problem. For example, twice a week we host a self-help meeting that is specifically open to and focused on the support of people with opioid use disorder who are getting prescriptions for buprenorphine from their prescribing physician. So support groups are available not just to Cleveland Clinic patients, but to patients of any provider in the consortium.
We need to stop people from dying so that they can get to that next step, which is treatment. We can't have them work a program if they die of their overdose, so we need to keep them alive to get them to that second step. Narcan is also known as naloxone, and it is the antidote to opioid overdose. It's a pure blocker. It's a very safe medication. It's not a narcotic. It's not a controlled substance, and it rapidly reverses an overdose when somebody is dying from an opioid overdose. As healthcare workers, we can also help to change the culture by talking to our patients about Narcan. The best way to get the medication in the hands of someone who's actively using drugs is to actually hand them that kit, because we know they get it, and we know that they don't have to pay any money out of pocket, and we know that they can walk out with that drug in hand. One of the benefits of being part of this consortium is learning from others. Metro Health was one of the first to approach this crisis from the harm reduction perspective using Narcan, but there are other areas where we're still learning about getting better access and options for treatment for patients. And so as we build our medication-assisted treatment program, we look to the other hospital systems who have much broader experience in that area to learn from them.
Medication-assisted treatment is taking one of three medications, either naltrexone in an injectable form called Vivitrol, buprenorphine or Suboxone, or methadone, and combining it with good counseling and 12-step support treatment for people with opiate addiction. Medications on their own decrease harm, meaning they decrease the death rate, they decrease some of the medical complications of addiction. But the medications by themselves don't result in any meaningful sobriety rate. If we look at 100 people with opiate addiction who do intensive outpatient counseling, aftercare, and 12-step meetings, at the end of a year, 20 to 30% will be sober. If you take those same 100 people and add medications, either naltrexone or buprenorphine or methadone, at the end of a year, the recovery rate will be between 40 and 60%. So medications, when combined with good addiction treatment, double sobriety rates. The healthcare organizations of our community, the 5 hospitals in the consortium specifically, have provided leadership in every area of medical, surgical, and psychiatric care in the past. And stepping up and providing leadership in how to safely provide medication-assisted treatment for opiate addiction is the new frontier and the place where the consortium really plans to step forward.
In order to start a consortium and to work together, I think the first thing you have to do is to realize that there's no roadmap to success. You're already doing really good work in your own communities, in your own institutions. Simply starting by sharing that will drive you much further than you believe.
I think one of the most effective ways that consortiums around the country can work together is to network and communicate what is going on in policy and coming together so that we develop a common policy platform that we can share not only locally but also at the state and national levels.
My fervent hope is that the consortium, which was founded on a community-wide need to respond to the opioid epidemic and the deaths, will broaden its mandate. And if we, as a consortium, take what we've learned on how to begin to grapple with the opioid epidemic and we extend it to grappling with the rest of the substance abuse epidemics in our community, I think this consortium will not only last, but will have incredible effects on the health and safety and quality of life of our community for decades to come.